we need to extend our frontiers to other areas, and therefore we found ourselves in this case because of the wise and visionary leadership that has been put in place by our board chair, Professor Mchamko, and his team, who have worked tirelessly to ensure that we have these services extended to other places of the country. I don't want anything else to be in course. For this moment, I'd like to invite our Director of Open Health Institute, Dr. Martha Chakulimba, to actually give us welcoming remarks. Thank you.
Thank you for doing my job for me. So, guest of honor, sir, our Honorable Minister of Health, Dr. Chilufya MP, our board chairperson, Professor Victor Mkonka, directors of board of directors from Occupational Health and Safety Institute, our key partners present with us this afternoon, Workers' Compensation Fund, Control Board, we have Radiation Protection Authority. We also have representatives from the union, distinguished stakeholders in the provision of health safety to all employees, ladies and gentlemen of the press, may I say all protocols of the health. This afternoon, the manager of the Occupational Health and Safety Institute to welcome you to the launch of our regional offices here today. Guest of honor, sir, the Institute will remain committed to the provision of excellent occupational health, safety, and research to enable employers safeguard workers and the communities that they come from, all under the umbrella of universal health coverage for all employees. You may agree with us this afternoon that alongside occupational disease and injuries, presenteeism is a hidden threat in the modern workplace, and it is now costing businesses and industries up to 3 times more than absenteeism does. With these statistics, we have acknowledged as an institute that this is only one among many factors that affect employees and factors that we aim to address as an institute. As I now hand over back to our Director of Programs to take us through the rest of our schedule this afternoon, please receive yet again a warm welcome to this event. Thank you.
I know we cannot have speeches continuously, but again, I would like to invite the dancers to come in front and give us some interlude of music as we await another speech. Please can come in front.
Now my pleasant duty to invite our board chairperson, Professor Victor Mkonka, to give his opening remarks.
Thank you very much, the Director. Let me start by recognizing our Honorable Minister of Health, who is with us here, MP, the Director for the Occupational Health and Safety Institute. I recognize the board members present, the various key stakeholders who are here, our colleagues from the media, distinguished ladies and gentlemen. I just have a few words, of course, before I invite our guest of honor, the Honorable Minister. Number one, Honorable Minister, just to say that we are operating in a COVID environment, and we are very mindful. This would have been a very big event for Lusaka, but we had to make it small, and also the program very short. Of course, practicing the social distancing and masking and so on, we ensure we're in conformity with our public health measures. Second, Honorable Minister, the day you commissioned us as a board, I think your message was very clear that you wanted to see a transformed Occupational Health and Safety Institute, which speaks to the current challenges and problems the country is facing. And I did make an undertaking on behalf of the board members that we shall respond to that. And today we begin to witness some of those tasks you gave us. We've been able to reorganize, rebrand the institute, and changed in terms of the leadership. At least now we see things begin to move in a very clear direction. Secondly, here we are, we had said we make it relevant. The industry is grown so that we don't focus just on Kitwe and the mines, but to reach every corner of the country. Honorable, I want to report today the task we'll be doing of opening our new structure. We are hoping in January or so we'll be able to commission also Solwezi, and then we move to Kawe. What we want is to have our presence in all the provinces, because that's where the workers are, and it's our mandate to look after the workers. The third, Honorable Minister, again we have undertaken is to ensure we shift our focus. Instead of letting people when they are retiring sick only to die, but to create a conducive work environment which promotes good health and make them enjoy their retirement in good health. And lastly, Honorable, we said we will embark on resource mobilization to make the institute sustainable than always crying to the grant. So we are growing up in terms of the resource base for the institute. I think soon it should be independent and be able to contribute equally to the health sector. So with those, Honorable Minister, I want to thank you, knowing how busy the schedule is, particularly this time of the year with the COVID, and I'm aware you're just coming from a cabinet meeting, but I think you are here for us to give that push and also encouragement to your team who have come from the Copper Belt for the major tasks ahead of us. So it's my rare honor and privilege now to invite you, Honorable Minister, to address the team here and the stakeholders, and then officially commission our new offices for Lusaka. So, Honorable Minister, I invite you.
Let's be seated. Let me begin by appreciating our dancers for exhibiting such skill. Indeed, this should be considered as employment and it should be very well rewarded. So if you didn't see me so well, just see me properly, so well properly. Well, I recognize the presence of the representatives of all the honorable ministers from the key stakeholder ministries, labor, mines, the board chairperson, Occupational Health and Safety Institute. I recognize all the senior government officials, the labor commissioner, all the other stakeholders that are represented at that senior level. I recognize the Provincial Health Director, Lusaka, or his representative, representatives from Chilanga District, and may I say all senior government officials that are present here and all representatives of our cooperating partners. It is my honor this afternoon to officiate at the grand opening of the Lusaka Occupational Health and Safety Institute office that is situated here in Makeni, Provincial, Chilanga District. I am delighted to be here today because I'm a firm believer that a healthy workforce is a productive one. The vision of His Excellency President Edgar Chagwa Lungu is for the country to attain the status of middle-income prosperous nation by the year 2030. And in our roadmap, 5-year development roadmap, the 7th National Development Plan, there are many measures that have been put in place to move towards that aspiration. It all focuses on improved productivity. And if we have to improve our productivity, then we must address one major determinant of productivity, that is a healthy and productive workforce. It is for this reason that today I am delighted that stakeholders have convened, one, to celebrate one milestone, and so demonstrate the importance of a multi-sectoral approach to development, a multi-sectoral approach to health. The Occupational Health and Safety Institute has been in existence since 1945. Of course, previously it was informed by the Ordinance Act, and this was the Silicosis Ordinance of the Laws of Northern Rhodesia in 1945, and basically it established the Pneumoconiosis Medical and Research Bureau in Kitwe. Now this mandate was restricted to examining miners, these miners who were suffering from silicosis because of what they were exposed to while at work, silica dust, and it was mainly for compensation purposes. However, with the evolution of time, this act was changed to Pneumoconiosis Act Cap 326 of the laws of Zambia, and later renumbered to Cap 217. In 2010, the vision expanded and the Occupational Health and Safety Act number 36 was enacted under the Ministry of Health, and it established the Occupational Health and Safety Institute as a statutory body under the ministry. Now the institute this time was given a broader mandate. It was to ensure healthy and safety of workers at the workplace. Not only miners, but all workers in the country. So the functions of the institute included work-related diseases. It was meant to raise awareness on health and safety issues and promote health and disease prevention among workers. It was also mandated to do medical examinations for workers for occupational health and safety purposes, catering for all industries beyond mining. And it was also charged with the responsibility to detect and investigate occupational diseases and injuries at the workplace. Now, remember, like I said, the role of the Institute in modern society cannot be overemphasized. An economically viable nation is driven by a healthy and productive citizenry, a workforce that is productive. Today, when we look at modern industry, we cannot rule out that the exposure to various aspects of what we do in industry may result in injuries, may result in diseases, and it's very important from the word go that we vest authority in this institute to ensure the safety and health of workers. In the past decade, we've seen diversification in the economy, in agriculture, in mining. We've seen diversification in manufacturing, and all these, including construction, have grown and taken different shapes. And you can agree with me that the growth and diversification and technological advancement in these sectors has resulted in its own challenges. There are hazards that our workers are exposed to. There are occupational injuries, diseases that our workers are exposed to. And it is at this juncture that the mandate of the Institute is called in. Now, this is supposed to be done in a multi-sectoral manner. In the workplace, in the mining place there are ministries that convene there. There are those whose mandate is to look at workers' welfare, whose mandate is to look at mining, whose mandate is to look at the health of the workers. So this is a multi-sectoral function, and this is the reason why you see the three ministries are meeting today. I would like to emphasize, therefore, that the statutory body, the Occupational Health and Safety Institute, will continue coordinating with ministries of mines, labor, including ministries of agriculture, fisheries, and livestock, just to mention a few, in order to effectively execute the mandate. Let me quickly thank the World Bank and the Global Fund for investing in technical capacity and infrastructure expansion for the Institute to operate optimally. The vision of His Excellency President Edgar Chagwa Lungu for universal health coverage requires that we leave no one behind. Therefore, workers are catered for not only when they're in their communities at home, but while they're at work. This is part of universal health coverage. With the generous support of the World Bank, working with the various partners, the center in Kitwe has now been transformed and it's being upgraded to meet international standards. It will be a center of excellence not only in Zambia, but the whole of southern region in the provision of health and safety services. The radiological department at that center is equipped with digital x-rays, and we have the laboratory that is well equipped with gene expert machines, amongst other equipment. Now, these developments are in line with Zambia's strategic plan for health as part of the National Development Plan, and it is part of the broad agenda for a healthier and productive nation towards our Vision 2030. The Institute has embarked on an expansion program and is now establishing its office here in Lusaka. This expansion program is not only going to be limited to this office in Lusaka, and I am confident that you're expanding to other places such as Solwezi and other parts of the country in the true spirit of decentralization. Distinguished ladies and gentlemen, as I draw towards my conclusion, I'd like to congratulate the Chief Executive Officer at the Occupational Health and Safety Institute, Dr. Chakulima, and your team for the hard work. You've landed running, and we've already seen the initial steps are right. The board chairperson at the Occupational Safety Institute and all the board members, Professor Mkonka and your board members, I'd like to thank you most sincerely for transforming that institute in a very short period of time. You managed to just look at the whole institute, turn it around, look at all the management difficulties that were there, and managed to reinstill sanity and ensure that it is where it is today. I want to thank you for the radical work that you did. A healthy workforce is critical to national development. I therefore charge you with a mandate to ensure that all the activities that will protect workers from injuries, from poor health attributable to the hazards of work are addressed. Work collaboratively with employers, both public and private, and ensure that our miners who are exposed to silica dust are protected from getting tuberculosis, not only when they are at work, but even when they are exposed with their families at home. Let us ensure that our people who are working in places where there is exposure to radiological substances are protected. Let us ensure that those who are working in various aspects of the economy that have to do with agriculture, manufacturing, mining, construction are all covered under the institute. This is key if we have to sustain the development we aspire for. With those remarks, I therefore remain honored to open the first Occupational Safety Institute office in Lusaka, a landmark step that shows your intention to decentralize and to work collaboratively to protect the worker and to push towards universal health coverage. President Lungu's agenda for the nation. I thank you.
Thank you, Honorable Minister, for that brilliant, enlightening, and very well-articulated speech. Indeed, it shows your care and the depth that you have for the growth of the health sector in Zambia. If I was to rate that speech, it would be more or less like a lecture at Harvard University. If we gave him more time, we'll be able to be well schooled in the area of occupational health. Thank you, Minister. Thank you very much for your kind remarks. I would like to welcome the dancers to come back. Now, before you beat your first drum, the minister gave you a challenge. If I were you, I'll dance as if it's my last day on the face of the earth. If I were you, I wouldn't mind breaking my legs, but the doctors are all here who can take care of me. Please do your best. The challenge is yours. Right now, we'll be going into the second session. We'll be cutting the ribbon, which will signify the official opening of this place. The minister, together with the director and the board chair, will move on to the entrance to cut the ribbon. And in that case, they will be able to actually move with the knife. So before you can actually move me, Honorable Minister, just a minute. I would like the dancers to dance and take the knife to the dignitaries. That knife must be honorably given to the honorable. So I want the honorable dance to take the knife where the minister is. As soon as the knife is presented, the minister with the professor and the director will move towards the entrance to cut the ribbon, and they'll proceed to actually inspect the building and the various departments that are within the Professional Institute.
Yes.
Hi, Roland. I'm okay. How are you?
Good. Yes, sir. Mr. Mitch is our chief radiographer. I could briefly share a bit of what they do.
Go to your digital X-ray. Yes, sir. This is one of the machines that was worked by Oda. It's one of the four. The two are stationed in Chilufya. One is here marked for Provincial. This is the one from Lusaka. Each one came with a printer. This is the printer. I should really want to print the next video. Now these machines are on network. So if now I'm going to see the extra fumes in kidney from this machine, I can actually limit it in kidney on this machine. Yes, sir.
Excellent.
And our diagnostic capacity, Honorable Minister, tremendously improved during this year after our doctors were trained in the reading of X-ray. So our ability to pick up most of these conditions for employees who need help area has improved a lot with this machine.
Well done. Thank you so much.
So here's our lab technician list here. You can share just a bit about what you do.
Okay, so you're welcome.
Turn around.
You're welcome to our lab. We are doing urinalysis. We are doing the TB microscope using the oral stain. We are also doing the RDTs, hepatitis C. We are screening hepatitis B and HIV.
Very good. Yes, sir. Well done. Thank you so much.
Thank you.
Thank you.
Technically our clinical area. So when the clients come, we have some clients actually on the attendant. This is the reception area.
Hello. Right, so this is our screening room.
Yes. So we have a digital scale there and weight machines. And you can come in here to the lesson and get the vitals.
Oh, this is fun. Sorry. Yeah. And the doctor's room. Right.
Yes. Dr. Chunga, maybe you could just share just briefly what we do when came forward to screen.
After the nurses are sent, we send them to us. Like you can run through the process. Start with the lab, then the x-rays, and then we come to the nurse. She does the visuals, and the BPs and everything. And after that, what we do here usually have a booking. So it's a list. And then I examine the client's full body examination. And I enter in the system. This is called MENIS. It's called what? MENIS. Alright. Yeah. It's a system. So once we enter the details, examination, and then set. So there's a system compiles everything from the lab to the X-ray to the nurse, and then we're able to have the data and then enter it appropriately and give a final decision, and then able to print the receipts, and then the client can get certificate.
What are the common conditions you speak out to people who come diseased out of occupation?
Usually in Chilufya we get a lot of causes, that's really katiba. But here most of the time it's just really hard communicating because
Excellent. What a possible good way.
yes, there's
Look and score.
So, Honorable Minister, the last but not the least department we have here is on the far end, which deals with the industrial physiology and hygiene. Yes. Chief Hygienist here, please, and take you through this.
Good afternoon. Welcome to the Occupational Hygiene Department. You mentioned about exposures when you're presenting. Our department, yes, very much, because it's got to do with what we do. Our department is meant to go into the industries. We check the exposures which might lead to injury and occupational diseases. So in front of you are some of the equipment which we normally use and do inspections. You mentioned about silica dust. This machine here is the machine which we use to take the samples for us to analyze, to check for silica. So these are some of the noise revoluters which we use to measure the noise we want to go into audiometry, diagnostic audiometry, to check if the workers are losing their hearing, and some out gas detections for checking chemicals which can affect the lungs and things like that. So these are basically some of the equipment which we use in the industry before we prescribe for the medical. So behind here, we've got some other equipment. Yes, this is, I mentioned about the instruments for measuring noise, for noise-induced hearing loss. So we even put the whole thing, as you mentioned, we have procured diagnostic audiometers. Those days we used to do audiometry in a booth, in a big machine, but it was a challenge for us to move around the country with a big booth. So these are actually a booth in itself. So you can test the worker at any site. So sometimes you go into the work site, since the workers cannot be brought to our site for examination, so we can do the examinations there. Even if there's a bit of noise, we can still do diagnostic audiometry. Then we do also lung function, spirometry, to check the lung function of our workers who are exposed to chemicals and dust like silica. So basically, these are a bit of the equipment which we use in our diagnostics.
Yes, very good. Well done. Just asking them, when are you going to visit discos to see how many
No, it is a challenge actually in the, like you're saying, even the entertainment industry. They are exposed to a lot of noise, but the ones who designed proper disco houses, the DJ has got a booth which has got acoustics determined to protect them from being exposed. But the patrons are the ones, and since they're workers like waitresses and barmen, those are the ones who are actually affected by noise, because they are there for most of the week, maybe 6-5 days in a week. They are there. The DJ himself is in a safe place.
Very impressive. Very impressive, and it's a very good statement. It's a very good way to begin. Yeah, and the multi-sectoral nature of the trade requires the complexion that I'm seeing here: agriculture, fisheries, and like so. Congratulations for stating clearly your intention to protect workers, to ensure health and safety of workers. Let's carry on this multi-sectoral interaction. And I've seen very clever scientists here and very well equipped labs and departments. So we thank the World Bank and the Global Fund for this great support. Yeah, the best MC on earth. Well done.
Thank you very much. Thank you.